Kwanza, all have you, Doc. A senior program technical advisor on gender and advanced sexual reproductive health and rights and social inclusion from Gender Health, as well as Mr. Godwin Mongi from Many Engagement Representative from CDF. As we are waiting for people to join, okay, let's take a moment to wait for everybody to join and come in line. But as we are waiting for that, okay, welcome everyone. I can see more people are joining in. We are yet to start our meeting. Tell a friend to tell a friend that we are now going live, and soon enough, we are going to start our meeting. But okay, as we are waiting everybody to join in, maybe we can do a little bit of a recap on Tanzania International Model United Nations. This is an assimilation of the United Nations General Assembly, in which in Tanzania it is hosted by the youth of the United Nations Association in Tanzania every year. Youth come together and discuss challenging or pressing issues in their communities and develop solutions, which is later documented in the resolutions that can be presented in various governmental and international organizations such as the UN itself, in order to develop solutions that can impact worldwide. And this year, as we all know, that the world has taken a toll due to COVID-19, and most of the stuff has come to a stop. I would not like to say a stop, but has come to a bit of a postponement or a delay. But as youth, we are entitled to continue to find ways to find solutions to our challenges and continue engagement and activeness in order to solve social challenges. And here at UNA Tanzania, via our Tanzania International Model United Nations, we have weekly meetings, virtual meetings, that we talk about different thematic areas that we have this year in order to have more engagement, to engage more youth with the speakers or guests, so that we can continue to see how we can tackle challenges on those thematic areas, but especially challenges brought about COVID-19. And as I said before, today we will be discussing the effects brought by COVID-19 on sexual reproductive health and rights, and how youth can advocate better on them. Well, allow me to introduce myself again. My name is Umilheri Yassin. I am a youth advocate on sexual reproductive health and rights and gender, and you can catch me via my social media handles at Umilheri Yassin. That is Instagram and Twitter. All right, as we are continuing to wait on people to join in, you are welcome on our chat box to share your social media handles or introduce yourself and say where you're from, and you can share your social media handles. Also, if you have any questions concerning the topic of today, you can jot it down on our chat box, and later on we are going to have a question and answer session in which your questions will be asked to our speakers, and they'll be providing more explanations on those questions. So you can use the chat box, introduce yourself, where are you from? You can share your social media handles if you have any, and if you have any questions, feel free to jot them down. As our meeting is going on, we are also live via YouTube. So you can tell a friend to watch us live via YouTube at Yuna Tanzania. Everything that is going on here, it is going to be directly aired on YouTube. But we also have our Instagram handle, which is Tanzania Moon. And we have also a Twitter handle at Moon Tanzania. This is where you can get all updates of what is going to be happening today and onwards, particularly on issues concerning the Tanzania International Model United Nations in 2020 this year. All right. Admin, there is a request. Somebody is asking if you can allow them to record this video for future or further references. I don't think if that should be a problem. The host is going to reply on that. Hello everyone, I'm Irene. Hi guys, thank you and welcome everyone. Soon enough, we are going to start our meeting. So we are having more people joining in. Hi guys, I'm Abdul Hamid. Abdul Hamid, welcome. Hello people, this is Chui Work with Hekima. I'm from Kagera, Tanzania. Tell me asante sana. Karibu Chui. Get me via Instagram as Aenda. Okay. Hi guys, I'm Bihaki, Country Director of Marketing and Incoming Volunteering and Professional Internships at ISEC in Tanzania. I'm STG enthusiast and so glad to be here. Welcome Abdul Karim. Everyone feel free to share your social media handles so that we can connect after the meeting. And in the meantime, as we're waiting more people to join in, let's have a few introductions from some of our speakers. And I would like to welcome Madam Tausi Hassan, which we are pleased and it is an honor to have you with us here today, Madam. Kindly join us in giving us a short of an introduction. Hello. Madam Tausi Hassan.
Yeah, thank you, Khair. I was muted, and that's why I was silent in a while. Thank you so much. And yeah, thank you. Good morning and good afternoon, everyone. My name's, as I was introduced by Khair, my name's Tausi Hassan. I'm Program Analyst Youth Development, working with the UNFPA. I would like to start by thanks the coordinators of the Tanzania International Model United Nations for organizing this very important session. The session that I do believe will help to widen knowledge and understanding of COVID-19 of each and everyone in here. I feel so honored to be part of participants to this session. So I really thank so much. But again, I would like to take this opportunity to welcome the speakers of this session, who are Ms. Esteria Kisoka, Mr. Mongi, and Dr. Katanta Simwanza. So I really welcome you on board, and much appreciation for accepting to be speakers of this session, and much appreciation for you to agree to share knowledge and your experiences with each and everyone in here. So thank you so much. Going back to the topic of today, the effect of COVID-19 on youth role in advocating for sexual and reproductive health and rights and gender-based violences. Just to get you on board on UNFPA, UNFPA, actually it's the United Nations Sexual Reproductive Health Agency, with a mission to deliver a world where every pregnancy is wanted, every childbirth is safe, and every young person potential is fulfilled. So about the topic, as we all feel the impact of COVID-19 in our life, it's something that most of you have never experienced before. Yeah, most of you, of course, most of you young people, we know that it has happened a lot of this pandemic, but learning from the past, it happened during those years, and you find that the impact was not widespread as this COVID-19 is. So I do believe that most of you have never experienced such the impact of such a pandemic as of this COVID-19. as we are seeing also, most of the sectors have been affected, including health, education, economic, and as well as we also see how the engagement and participation of young people have been affected. So the impact is very huge. We see globally there are efforts that have been done in responding to the situation. And we at the UNFPA, we have our strategic priorities and the interventions to ensure continuity of the sexual reproductive health services, to ensure addressing gender-based violences and ensuring also the supply of modern contraceptives and other reproductive health commodities. UNFPA works to strengthen the capacity of youth organizations to engage safely, effectively, and meaningfully in the ways that enables young people to augment their knowledge on the virus and play an effective role in the prevention and the response. So we do believe on youth, and the youth can be part and parcel in the response of COVID-19. Again, UNFPA works to ensure that measures are in place to mitigate the risks of all forms of violence against adolescents and young people, particularly adolescent girls and young women, because those are in most cases, when such kind of pandemic happens, they are the ones that suffers a lot compared to other group of people. So having said so, I would like to once again thank you very much to the organizing team of the Timoni 2020. And thanks all of you for your participation, of which I stay hoping that the lessons that we will draw from this session will be applied in your daily advocacy work. So I would like to end by saying we should make sure that we protect ourselves, and we should protect others against Corona. So thank you so much, and thank you for listening, and wishing you a very fruitful sessions. So karibuni sana.
Thank you very much, Madam Tausi Hassan from UNFPA. It is such an honor to have you, and we are delighted to have had an opportunity to hear you say something in our meeting. Apart from that, I would like to extend my sincere appreciation to UNFPA for always engaging young people, always finding ways to bring meaningful engagement for young people, most especially in sexual reproductive health and rights and gender. Thank you very much. Now, without further ado, I would like to welcome our first speaker, who is from Plan International. Her name is Madam Esteria Kisoka. She is the Program Director on Adolescent Sexual Reproductive Health and Rights. Madam Esteria, kindly welcome.
Hello, good afternoon all. As I've just been introduced, maybe I should as well introduce myself. So my name is Esteria Kisoka. I work for Plan International as Program Director for Adolescent Sexual Reproductive Health Interventions, including maternal and neonatal health as well. I'm so delighted really to join this meeting, and I'm happy to be with you today. I'm so delighted as well to be part of your speakers for this session today, and I'm happy to hear from the youth again. So for me, I will around issues around sexual reproductive health and how our work as youth, we have come into challenge when it comes to COVID. But I will really very general in terms of, as we know that several different disasters, and this is one of the biggest disasters, I would say, that has really, like Madam Tausi has said, has perhaps touched all the countries in the world, and it has really brought a lot of challenges globally. For disasters like this, we actually see a lot of challenges that are emerging, and most of the time, whether it's a country challenge or it's a global challenge, overall there are specific groups that are really affected by these disasters. And one of the groups I would say is youth, the adolescents, but also children and mothers. As we have this session today and we are here talking with youth, so we will perhaps talk and focus more on the youth. Work that adolescents and young youth people are doing, we also can be affected. And even with the COVID-19, we as young people, we have been affected. So the discussion today is mostly looking into our roles in advocating for adolescent sexual reproductive health. And we perhaps ask ourselves, are our roles affected by COVID-19? And I say yes, significantly they are being affected. And how have they been affected then? With my thinking, with the way we have seen in our programs, I will perhaps categorize the effects in 3, if not 4 different levels. And my focus will only look into the challenges that we have had as the role of advocating. And one, it's at the community level. And even before looking at the community level, let's start with the family level. We know that we are young people. Some of us are still with our families. We depend along with our families. And at the same time already, as you're a champion, as you're an advocator, you feel like you still want to go out, to go continue doing your work in advocating on the rights of adolescent sexual reproductive health. But at this moment where we have COVID, there is a limitation. And the limitation starts down from where you belong, the family. And, some countries, they have totally locked down. So that means you don't go out. Some other countries, we don't have lockdowns, for example, Tanzania, but there are other limitations. We are insisted to protect ourselves. And the issue of PPE, that is personal protective gear, may also be a challenge. Taking an example of a youth who totally depends getting money from the parent. And at this moment, even economic way of, the country has been affected with COVID. That means even at the family level, you may get that challenge of economy. That in such a way, a mother will perhaps not be in a position to support you, either go out, continue doing your work of advocating and such things. But again, the biggest thing that we have seen really is the fear. It's not only with COVID, but anytime when you have disasters, big disasters like this, there's always fear. So fear itself makes a person, don't move ahead with what he or he has been doing. So that is briefly on the family side. But now coming to the community, where, as we advocate for sexual reproductive health, we also know that at the community level, there are a lot of barriers, there are a lot of challenges, there are a lot of things that really hinders young people to access sexual reproductive health. And one of it is even the society and the community that we live. Now, we as advocates, we knew that we were using different interventions and different ways in getting the community understand the importance and the need of the youth when it comes to sexual reproductive health. But this time around, when we have the COVID, it has really impacted our role. And how? One, the same thing of lockdowns. Some countries, people don't move, but there is a tremendous fear that people have. But again, how would you go to those interventions where already we see people are either confined in their homes, we like in a community where you would probably use an avenue where the community had meetings. We have seen that meetings to some done, perhaps they're done in a way that it's not really the right way for you to intervene and either showcase or discuss or advocate. At the same time as well, the leaders that you think we are there to advocate for our rights, at this moment where you have disasters, the leaders, they only focus in other things. They focus more on the disaster itself, and you don't have that opportunity. It's at the community level. Now, in terms of, we want to talk of advocating in, say, at the government level, whether it's policy change, whether it's any kind of a need that and discuss and either change the policies or guidelines, that is even harder because all the country at this moment, when it comes to pandemic issues like this, the focus only looks into how best can we really overcome the challenge. And even on the aspect of, say, when you have interventions in programs, let's say, and we have youth where you may have recruit youth with an intention of them being champion, and yet you would want to capacitate them. And there's an opportunity, say, of traveling to another country, to you either getting an opportunity of, getting more knowledge on advocacy. At this moment where, there was even limitation on travels, that has also impacted our work on advocating for SRH services or SRH rights for adolescents. I will take you back again on the services. We do know that part of our work is provision of education to young girls and boys and our core youth. But at the moment of COVID, where you may have done your good work of advocating, encouraging people, giving information, making them understand, and also linking them to the facilities where they can go get services. But they may get a lot of obstacles when they go to the services because with the nature of the country, say, where we have challenges on human resource, maybe at the disaster time, the providers themselves may be more involved to address the challenges of COVID or any other disaster, and they leave along other services. And once you link that young person to that service, he or she may not get a service because the provider is now linked to another work that she's employed or entitled to do. So briefly, those are the things that I'm looking into as the challenges that we are seeing, but at the same time, in different interventions, we have seen, some programs that we could not continue working. So the thing is, what are we going to do? We know that COVID may not get to an end, or even if it gets to an end, any other disaster may come. At this moment, when we have this pandemic, I think it's a time for us now to quickly think a different way of doing things. And for this, I will leave for the entire youth to have a discussion and say, we know that these are the challenges, but now what are our things? What are the ways that we think we can continue doing our work by using a different intervention or different way or different models of doing things? So that's it. Maybe I pause there, then we will definitely have a session to have question and answer, and we will discuss more. Thank you.
Thank you so much, Madam Esteria Kisoka. What you have given so many insights, especially on how COVID-19 has affected us, you particularly on advocating for sexual reproductive health and rights. You have talked about at the family level, where there has been a lot of effects, especially on income. And so that has hindered the continuation of advocacy by young people. But at the community level, where now there is so much fear and surrounded by the policy of lockdown, people can no longer move from one place to another, and that has made it a lot difficult for advocacy to continue. But as well as the shift of focus by the government or the leaders, in which at this time, most of the leaders are focused on seeing how we can survive amidst the pandemic. And so advocating for change in policies, especially concerning gender and sexual